Many times after 2 months off the birth control pill, a woman won't have a normal cycle. So then we need to look at, okay, what is the underlying problem? And what are the hormonal issues? What can we do to help restore balance in a woman's hormones? Yes, research has shown that long-term use of birth control pills does decrease fertility in some women. And interestingly enough, a lot of women are started on birth control now, not just for the birth control piece or the preventing pregnancy piece, but to treat hormonal symptoms such as PMS symptoms, heavy bleeding, acne, PCOS, just to name a few. So we're treating those symptoms, but we're not really addressing the underlying hormonal problems. So with that being said, many times when women have been on birth control, especially long term, these hormonal imbalances haven't gotten better and many times have gotten worse. So when a woman comes off the birth control pill, these underlying hormonal problems are still there and, like I said, maybe even worse. So each woman is different, and once in a while a woman will come off birth control pills and in a couple months have a normal cycle. That's great. Many times after 2 months off the birth control pill, a woman won't have a normal cycle. So then we need to look at, okay, what is the underlying problem? And what are the hormonal issues? What can we do to help restore balance in a woman's hormones? Every woman is different. Everyone who comes off of birth control pills, or we call them oral contraceptive pills, OCPs for short. So each woman is different, and their body could either react differently to the birth control pills, or probably more likely is having different underlying hormonal problems to begin with. And most likely these aren't resolved, and so they need to be addressed before a woman is able to have normal cycles, and most likely, and hopefully the goal of normal cycles to be fertile and have a healthy baby. Everyone is different as far as how they react once they're off birth control medication. So it could be anything from just really irregular bleeding to even not having a cycle for a period of time. Many women do not have a period for a long period of time after coming off the medication. So we do have a way of, we think of it as energetically, the birth control pill can have an effect on women's bodies and their cycles. And there's a homeopathy regimen or protocol that we have to help reset the woman's body after, we call it post-pill. So after oral birth control pills, then we can help their bodies reset after being on that medication. One way to really address optimizing our hormones is to look at what we're putting into our bodies. There are many xenoestrogens in our environment, and that includes in our healthcare and beauty products and the products that we consume. There is one thing specifically to look at in our products and to avoid phthalates in our beauty products. Those act as estrogens in our body, even though it's not technically an estrogen, but our body sees it as an estrogen and can affect our hormones. We also, very important to avoid plastics. So especially anything we're drinking in a plastic water bottle, because that mimics estrogen as well, and it can throw off our hormones. We want to avoid drinking out of a plastic water bottle. We want even receipts. The receipt you get from a grocery store or a store, it contains BPA, so that mimics estrogen in our body, and we can absorb it through our skin. So I say either say no thanks to the receipt or ask for an email receipt if you need a receipt. And then another way I like to mention a thing to avoid as much as possible, the lining inside cans, like your canned food, are lined with plastic. Even if it says BPA free, most likely it has some other chemical that might mimic an estrogen as well. So as much as possible, I mean, once in a while you'll probably consume some kind of canned food, but if you can do the fresh alternative or some kind of alternative, that's better. So we also want to avoid dairy. Dairy, there's many hormones, just even if we're getting organic cow milk, there's hormones in the cow's milk. So that is going to add to that's an exogenous, meaning outside of our body coming in, hormone to potentially disrupt our normal hormone balance.
If you want to learn more about optimizing your health and your fertility, then follow me and subscribe to learn more.